As Nigeria joins the rest of the globe to mark World Malaria Day 2025 with the theme Malaria Ends With Us, Reinvest, Reimagine and Reignite, health practitioners and other experts are calling on Nigerians to pay more attention to the disease that has long been relegated to the annals of preventable illnesses elsewhere, which has continued to wreak havoc in the country. World Malaria Day is an occasion to highlight the need for continued investment and sustained political commitment to malaria prevention and control. The theme for World Malaria Day 2025 aims to raise awareness about the urgent actions needed in the fight against malaria, emphasizing the importance of continued investment, innovation, collaboration, and commitment from the global malaria eradication community. According to WHO, Nigeria accounts for approximately 27% of global malaria cases and 32% of malaria deaths. Let's bring in infectious disease researcher of the Department of Pathology, University of Cambridge, Dr. Ademola Ayenoro. Well, I guess that designation wrong. My guest is joining me from the United Kingdom. Thank you for joining us, Doctor. Apologies for the mix-up in names there. Malaria remains what appears a leading cause of death in Nigeria, especially among children under 5 and pregnant women. What would you say the challenge really is with all the years of education, enlightenment, and even recently the introduction of vaccines last year?
Well, thank you very much. Just like you highlighted, malaria continues to be a disease of serious concern, not just in Nigeria, but globally. And Nigeria accounts for the country with particularly the largest burden of malaria. And yes, quite a lot of work has been done in Nigeria and continues to be done in Nigeria, with regards to tackling malaria. But of course, there's still a lot that needs to be done and can be done. And this year, that's why the WHO is partnering with other partners to say, well, malaria ends with us, and calling on all the stakeholders, which includes the government, the health professionals, as well as the communities, to come together to work to reinvest in healthcare. Because to answer your question, what are the barriers, or what has stopped us from achieving the goal of a malaria-free Nigeria? If you should say that, investment has not been, at its best, and so the WHO is calling on the government to refocus and reinvest rather in malaria treatment, malaria prophylaxis, malaria eradication, essentially, as well as for the healthcare professionals to reimagine. Last year, we saw the rollout of the malaria vaccine in Cameroon for the first time ever. And, it is innovations like that would enable the eradication of malaria, and we haven't seen such innovations in a very long time. So yes, the vaccine signified a pivotal step as to eradicating malaria, and we didn't have that before, and that's why it's lingered. But this year, WHO is saying we can reinvest, we can reimagine, and we can reignite as well. That's talking to the common person on the streets, the communities, to reignite the urgency, reignite that consciousness that malaria is still very much around within us. Malaria is deadly, like you quoted. Nigeria has 30% of global deaths of malaria. So, we need to understand how important and how serious malaria is.
Korebe, general practitioner, joins me from Birmingham, United Kingdom. Apologies, I mixed up the names earlier. I've spoken with, a whole lot of doctors today, so I'm getting it mixed up. But let's talk about what's happened in Birmingham, where you are, because malaria is considered a tropical disease, but the UK reported over 700 cases, I think, last year, with Birmingham being a hotspot due to its diverse population. So as a general practitioner, how do you handle diagnoses, and treating malaria in in non-endemic setting?
Yeah, absolutely. Very important question. And you're right. Last year, we had about 700 cases. 2 years before that, we had about 1,500 malaria cases. And the United Kingdom is not endemic to malaria, but malaria doesn't stay within borders. So as people move, malaria also moves. And of course, in the UK and in a place where I live, like Birmingham, which is very diverse, and you have people going from, Nigeria to the United Kingdom and back, from Ghana, from India, and all of that. So malaria, is amongst us, as it were. But as a general practitioner, I guess my role is to have a high degree of clinical suspicion when I speak to patients, especially patients who have a travel history of visiting endemic areas, even as long as up to a year ago, because the parasites can sometimes live in the bloodstream for that long.
Indeed.
Travel history coupled with, symptoms like fever, fatigue, abdominal symptoms and things like that can be highly suggestive, of malaria. But then it is also very challenging because every day we deal with other viral illnesses, including things like COVID.
Right.
And, sometimes the fever, the fatigue can also mimic other symptoms. But I think the travel history to endemic area is key.
All right.
And as general practitioner, we just maintain that high clinical suspicion.
We have completely run out of time. You didn't add the fact that you're a Nigerian yourself, so perhaps the experience of treating the disease would have also impacted strongly. But we have to go now. Dr. S.N. Okorobeg is general practitioner who joins us live from Birmingham in the United Kingdom. Thank you for your contribution.